Chronic pain affects the lives of millions of adults every year. Estimates say it could be as many as 1 in 5 of us. It can seem hopeless, especially if surgery or pain pills have been recommended. But there are other long-term solutions. Physical therapist Joann Pung is a chronic pain specialist. She is here to explain how she can help. Great to see you.
Thank you.
And I love that you said right off the bat, this is not traditional physical therapy. So how can physical therapy help pain?
So physical therapy, there's a positive connotation to it, and there's also a negative connotation where people say, I've done PT, I've done it so many times, it just doesn't work.
Right.
So initially, what I tell patients is that whatever you've experienced as physical therapy, just forget that, because this is completely different.
So you're kind of resetting our body to help understand what's causing pain, correct?
Right, so the initial trigger of pain is usually something else. It can be like bone, arthritis, it can be a herniated disc. But what happens with chronic pain is as you are living in pain, you start to compensate and adapt and modify your behaviors because you are trying to minimize the pain, right? So in the process, your body will have an asymmetry or a lopsidedness that people don't even realize they have. So now the consequences of the compensations are their problems.
And that makes so much sense, right?
Yeah.
I'm going to favor something because it hurts, but then I'm creating more problems and new types of pain.
Absolutely.
You provided us a couple of visuals that I think can really help us understand what lopsidedness and reaction to pain can do. What are we looking at skeletally here?
So when you have compensations, it's usually muscular consequences, right? And those muscular consequences will lead to one shoulder being lower. They'll notice that it seems like when they're standing, one arm is longer than the other. One breast is actually lower than the other. It isn't. It just means that their body has tilted, and in the process, they look the way they do.
So physical therapy, you're helping to realign that. I know we've got a hip photo that you can kind of see a before and after. What are we looking at here?
Yeah, so in this particular one, if you are favoring one leg because the other one is very painful, this could be a consequence to it. And people don't realize when you stand, your hip is now shifted. So we recognize that, and when you are in that position, that's not how a normal body should perform. And so what we do is we just recalibrate the body. We just put it where it belongs, that's a classic example. And if you notice, that lady is wearing the same shirt. So that occurred in one session. So it's very predictable because muscles are predictable. They will respond appropriately if you're doing the right thing.
I like the fact that you use the words lopsided and recalibrate, because that makes sense, right? Like our bodies are doing something that isn't natural, which is then creating chronic pain. So the pain,
Absolutely.
The pain is telling us something.
Yeah, so pain is really just our alarm system telling us something's wrong with it. So when someone has a gas pain, if you notice, you have pain in your stomach and you get rid of the gas, pain goes away. Same thing if you have a broken arm, it hurts. Once it heals, pain goes away. So it's really just the body's way of telling us something's wrong with us. So in the case of chronic pain, if I'm going to split the body in half, right side and left side, if one side functions differently than the other, it's also going to communicate with you through pain. So if you actually recalibrate the body, you can shut off the alarm system. Your body becomes more capable of what you're asking it to do, which can be sitting, walking, whatever it is that you're trying to do, like sleep better, for example.
Right.
You're really just trying to make the body capable of what you're asking it to do. And it's as simple and it's almost common sense. Let's just make the body stay normal, and then it will shut off that alarm system.
Well, and it sounds like such a valuable way to avoid pain pills, avoid some of the things that make us very nervous when we're treating pain.
Yes, and that's one of the goals that people have, the ones that I'm working with and helping with. It's usually trying to avoid surgeries, trying to stop their narcotics because it's not a good way to live, right? And most importantly, people just want to have a normal life. And when you're having chronic pain, a lot of times people have this idea that you have to accept it, that you have to live with it. In fact, people say that's part of aging. And I actually disagree with that. If you maintain symmetry, you're less likely to develop pain. And I see that every day. So
that is a wonderful takeaway, that you don't have to live with pain and that there are ways to fix it that don't have to involve surgery and drugs. So thank you for sharing. I think we've all learned a lot. You can learn about help for chronic pain. It is not something you have to live with by visiting the website manualconciergept.com to learn about a different kind of physical therapy. We'll be right back.